Module Overview. Nutrition is a cornerstone of recovery and quality of life for patients in healthcare settings. Many hospitalized or homebound patients rely on caregivers and bedside attendants to assist with feeding, dietary monitoring, and nutritional upkeep. This module delves deeply into the science, procedures, standards, ethical considerations, and skills necessary for assisting patients with feeding in compliance with global health accreditation requirements such as WHO Nutritional Guidelines, CDC Nutritional Standards, ISO 22000 for food safety, and the Joint Commission Standards on Patient Care. This module equips you with the theoretical depth and operational confidence to support patients in maintaining adequate nutrition, regardless of their physical or cognitive limitations. It highlights the importance of dietary monitoring, feeding techniques, communication, cultural sensitivity, and infection prevention related to food handling and feeding processes. Understanding the role of nutrition in healing and recovery. Nutrition is therapeutic. It supports tissue repair, immune function, fluid balance, energy production, and mental alertness. Undernutrition can lead to muscle atrophy, delayed wound healing, pressure ulcers, cognitive decline, increased infection risks, macronutrients, carbohydrates, proteins, fats, micronutrients, vitamins A, B complex, C, D, E, K, and minerals like iron, zinc, magnesium. Common dietary orders in healthcare settings. Healthcare providers issue dietary prescriptions tailored to the patient's condition. Type of diet description. Regular diet, balanced nutrition for healthy patients. Soft diet, easy to chew. For patients with dental issues, pureed diet. For patients with swallowing difficulty, dysphagia, NPO, nil per os. Nothing by mouth, used before surgery or tests. Diabetic diet. Low sugar, controlled carbs, renal diet, low potassium, sodium, phosphorus for kidney disease, cardiac diet, low cholesterol. Sodium for heart conditions. Clear liquid diet, water. Broth, tea, used after surgeries or GI distress. Feeding techniques for dependent patients. Positioning. Always sit patient at 90 degrees upright or as close as possible. Maintain head elevated 30 to 45 minutes after feeding. Support neck and back utensils and equipment. Adaptive cutlery for tremors or grip difficulty. Non-spill cups or straws. Pureed meal trays for dysphagia. Pacing and observation. Feed slowly, small bites or sips. Watch for choking signs. Coughing, watery eyes, sudden silence. Allow patient to chew and swallow before offering more. Use napkins or bibs for hygiene. Preventing aspiration and choking. Aspiration occurs when food or liquids enter the lungs, leading to infection or choking. Key strategies. Head up, chin down technique. Monitor for wet voice, gurgling, or difficulty swallowing. Provide thickened fluids if advised. Avoid rushing the patient. Use suction equipment if necessary. Done by a trained professional. Feeding tubes and special considerations. Patients may have nasogastric, PEG, or G tubes. While unlicensed caregivers may not administer feedings through tubes, they assist by reporting leaks or dislodgement, checking the surrounding skin for redness, positioning the patient upright during and after feedings, documenting any vomiting or signs of distress. Cultural, religious, and ethical dimensions of nutrition. Respect dietary restrictions, halal, kosher, vegetarian, gluten-free, etc. Observe fasting periods, Ramadan, Lent, etc. Communicate clearly and document preferences. Involve family or clergy when dietary choices conflict with medical advice. Maintain dignity and privacy while feeding. Infection control during feeding. Wash hands before and after feeding. Disinfect surfaces. Avoid touching inside of cups, utensils, or feeding bottles. Gloves may be used if handling bodily fluids or in high-risk settings. Never reuse disposable utensils. Label food and avoid cross-contamination, e.g., fish with vegetarian items. Monitoring, documentation, and reporting. What to monitor. How to record, when to report. Amount of food eaten document as percent, e.g., 75% of lunch. If intake is less than 50% for 2 or more meals, fluid intake measured in milliliters. If signs of dehydration appear, vomiting, choking time, type of food, duration, immediately report to RN refusal to eat. Note, reason if known. Escalate if persists beyond 1 day. Swallowing difficulty. Note consistency issues. Immediately report dysphagia signs. Use of food intake charts, hydration logs, and nursing care reports is crucial for care continuity and accreditation audits.